5, 4, 3, 2.
Hello, I'm Paul Peterson for Aging in LA. Perhaps you are not familiar with the term evidence-based programs. Evidence-based programs and approaches are those that are based on prior research and evaluation findings. Today we will examine programs funded for senior citizens in California that have undergone rigorous testing and evaluation before being put into practice. Stay tuned for Aging in LA. Recently, the California State Department of Aging and the State Department of Health were awarded a grant from the U.S. Administration on Aging. This initiative is entitled Empowering Older People to Take More Control of Their Health Through Evidence-Based Prevention Programs. The goal of this initiative is to bring evidence-based self-management programs into the practice of age-based organizations such as senior centers, senior housing sites, and other community organizations, including faith communities. The evidence-based program includes the Healthier Living program, which encourages participants to maintain and adapt practical strategies to manage their health conditions. We will discuss this program today with our guests, Jennifer Wykowski from the Partners in Care Foundation and Muriel Cuzzi, representing Kaiser Permanente. Welcome to you both. Thank you so much for coming here. Jennifer, let's start with you.
Sure.
Tell me about this a really wonderful grant that was awarded for an evidence-based program.
Sure, it's a great opportunity because 16 states were funded by the Administration on Aging, and we're so proud that California was chosen as one of those states. So this opportunity gave the California Department of Aging and Health Services to start with certain counties to bring these evidence-based programs to. So Los Angeles was chosen as one of the pilot counties.
That's outstanding. Well, we have many excellent programs here, and I kind of call them best practices programs. Muriel, Kaiser Permanente has a wonderful database, so you can actually go mining into the statistics to find out what works.
Right, and this program truly works. It's been in our Kaiser Permanente facility since 1997. We were part of the evidence-based research for this program, which is the program was developed by Stanford University, their Patient Research Education Center, and they collaborated with Kaiser Permanente to do the research because we have that.
Well, to explain that a little bit further, we recently visited with June Simmons, who is president of Partners in Care at their offices in San Fernando. She spoke of the importance of bringing evidence-based programs to community locations.
For years, we've been providing human services, doing what we thought was good and what worked for people. But now research has advanced in its ability to measure what really makes a difference. So now when we work with people, let's say, for example, on building better health and how we can care better for ourselves, we have very strong evidence that's come from very sophisticated research that tells us what works and what doesn't. So we're trying to shift our programs in the community throughout America now, especially for older adults, to what we know works, what's cost effective, what's efficient, and what's high impact.
Partners in Care, are the partners across the board, caregivers, your pharmacist, your general practitioner, doctor? Is that what you're trying to coordinate?
Hospitals, health systems, the insurance companies, older adults themselves, their families. We just think a lot of people need to join hands to really address how people stay well, and if they have chronic conditions, how they really reduce the effect that those conditions have on them so that they have better quality of life, and so we don't break the bank for our healthcare system.
When you said physician groups, are the physicians generally aware that this is a changing environment, that their patients are rapidly growing older and they need to re-educate themselves?
Everyone who's paying for health care has noticed that as you live longer, while you're extremely valuable, full of wisdom and experience, some of your parts might start to wear a little. So you become a bigger user of health services, even though you're an intact person. So that cost, I think, creates an awareness. Everyone's aware of that. And that creates a motivation to really look at, well, number one, if people are using health services, it means they're suffering. There's something wrong that's making them uncomfortable, that's getting them to reach out. So number one, we want to address quality of life and having people feel and be as good as they can, which is they can do a lot about. And number two, we don't want those costs to use what could be avoidable health services.
Well, what about people who are able to set goals that reach out even in advanced years and say, I'm making plans for a year from now? That's got to be helpful too, just for mental health.
What we find is setting goals is fundamental, meaningful goals to me.
Right.
So, for instance, you know yourself, if you're going to your high school reunion, you're going to look hot.
Yes, right.
So it's that kind of goal that moves people. So for some people, it's just being able to walk to the curb on their own, because then they have access to the access transit that can, so then they're not jailed at home. They can go where they want to. They can go where they need to. For some people, it's being able to walk to the mailbox. For some people, it's being able to hold a grandchild safely. They're walk down the aisle at your grandson's wedding. There are important things that will encourage people to really adopt lifestyles that allow them to stay vigorous, to stay on top of things, and to optimize how they feel and how they function.
The team of caregivers that surrounds many seniors, they can benefit from this as well. Reduce those stress levels, remember that there is respite care, and helping the family understand that this really is a holistic approach. You're just going to have to handle everything.
And it's good for them. It's good for everybody to manage nutrition, physical activity. It impacts pain, mood, self-efficacy, just a sense of well-being and that I'm doing well, and it reduces risk. At every age, it reduces the risk of being overweight, of diabetes, of depression, and a host of other things that are all really helped.
Boy, she was wonderful to talk to. June is a wise woman. You know, when I talked with her, one of the parts that I was struck with is we don't need to reinvent the wheel. If we've got a good wheel, we might as well operate on that wheel. And you can just see how sensible approaches that we know have worked ought to be applied more generally, right?
Correct. Yes. And that's exactly what these programs do. They empower participants to take control of their lives, and that's all we ever want. You know, as we grow older, we want to maintain that control over our lives, and these programs give you that opportunity.
Right. And when you say control over our lives, that's not just our personal health as seniors, but the way we deal with our children and grandchildren
Our
and
loved ones,
manage health
Our
issues.
providers.
Right.
Yeah, and we have all seen that the person who takes charge of their health issues, they get well quicker.
Right.
They do.
And their perception changes.
Yes.
You know, their condition may deteriorate somewhat, but what they're feeling is that, you know what, I can take charge and I can do something about this.
And that's why I love this idea that we are sort of bringing the whole, what used to be called silos of care, into a more integrated approach, because the evidence is in. This approach works. Now, tell me about Partners in Care and what makes this unique in their approach to these health issues for seniors.
Sure. Well, Partners in Care, we're a nonprofit located in the San Fernando Valley of Los Angeles, and our mission is to change the shape of healthcare. And like June said, we look to areas where there's a lot of healthcare services being delivered, but maybe we're not getting the best outcomes. So Partners in Care's role here is to be able to provide these evidence-based programs. So we're serving as a project state to be able to leverage that and work with other community partners like Kaiser.
Well,
offer
and
it.
it just makes such sense. If you think of the balloon, you push in on one side and it sort of pops. That's really what we're doing, because
Right.
I have actually witnessed this, like going to the pharmacy on behalf of my mother-in-law and finding an intelligent and engaged young pharmacist who goes, wait a minute, are we sure these instructions are correct? Because she knew she was part of my caregiving and my mother-in-law's health.
Right.
And that is how it works. And nobody is bigger in the field or has had more experience than Kaiser Permanente. They've been an innovator for decades.
Yeah, I'm very proud of that.
Yeah, well, you
I'm
should
proud
be.
of the collaboration that we've formed with Partners in Care and all the other community agencies. It just expands our reach. And I'm very proud of that we can do that.
And it's important. I mean, so many things that we used to think were intractable, at the onset of Alzheimer's, for example, there are, in fact, some programs that can sort of either slow the progression of this disease or actually increase a person's acuity because the people who are delivering the health care understand that by taking a broader approach, we can sort of push the ball down the field. And that's good. So what kind of collaborations do you look for beyond, say, the big guys like Kaiser Permanente? Are you also into like doctor groups and dentist groups?
Sure. Well, we want to work with physicians. We want to educate them that these programs are available so that they can refer people to these programs, even dentists as well.
Sure.
But we partner with other nonprofits, community-based organizations, healthcare systems, so that they can provide this benefit. Because it's evidence-based, we know they work
See,
and they
that's-
get good outcomes.
Right.
We just need to get it out there to the public.
And I don't care what kind of business you're in. At the end of the day, if you have done something worthwhile, it makes you feel better.
Right.
And I'm sure it was kind of like that universal socket. You can plug in this wire and you plug in
Right.
this wire, and lo and behold,
Right.
something good happens. That's great. When I like the aspect of remembering dental health, oral hygiene for many seniors is something that sort of fades away, or it's too difficult to go to the dentist, and yet it's
Right.
implicated in heart ailments and diabetes, for example.
Right.
So this is a good thing. There are a lot of very traditional people, though, in the healthcare system who are sometimes reluctant to change. How does Kaiser Permanente approach this idea of a new program? Is something that has to go through like 100 different levels?
Well, it's not new to Kaiser Permanente. It's been in existence since 1997, but changing that culture of care is very difficult. We've had to do tons of presentations to our physicians. We have to keep educating our physicians that, we need to put our patients, we need to ask them what it is that they want.
Yes.
Instead of just prescribing what we think is important for them.
Right. Well, just when a patient comes through the door, something's up. I mean, none of us like to go to the
Right.
doctor, the dentist, and if we are having care issues, we don't want to admit, oh, I'm not up to this, but we all have to do it. We do. Well, this is good.
And when
Yeah.
that patient comes into the office, it's that teachable moment where that provider can impart information about a class they can go to, or to expand their role and talk about physical activity.
Well, and I like that, the idea that a physician with new knowledge can say, you might find some benefit by going to this support group, for example, especially on issues which can be troubling like nutrition or an
Right.
exercise program, or how to deal with family members who maybe aren't being very helpful as you try to remake your life. Now, when we talk about evidence-based, this is looking at programs that you can actually measure the value and the worth, not only in terms of dollars, but in lives that have been improved, correct?
That's correct.
Yeah.
Right. They're based on credible research, and they have standardized evaluation measures
Right.
that organizations, if they choose to adopt this program like Kaiser has and like some of our senior centers and senior housing projects, they can use those evaluation measures to see, are we doing the project right? Are we getting the same outcomes that were done in the randomized controlled trials?
And that's really important, because then you can measure your progress.
Right.
Did you know how you're doing?
Right.
And we want to replicate those outcomes in any situation.
Exactly. And
Yeah.
that's important, because this population is swelling hugely of our seniors. Now, it's time for a short break. When we return, we'll talk more about evidence-based programs for seniors. and we'll visit a workshop at one of our senior centers. Please stay tuned. We'll be right back.
The Los Angeles Department of Water and Power wants to give you up to 7 free shade trees just for completing a workshop, either online or in your neighborhood. The Trees for a Green LA program offers LADWP residents over 40 different varieties of free shade trees. Trees benefit the environment, save energy, and add beauty. Get your trees by participating in an online workshop by logging on to ladwp.com/trees or call 1-800-GREEN-LA.
It's fun to be a good neighbor, so say hi to your new neighbors at the LA Zoo. And bring Grandpa. They've got a walking buddy for him, too. They've expanded, so there's even more to see and do. Don't wonder who's here, because just for kicks, they've got birds on sticks. Whatever you do, make sure Mom and Dad come early, because they're certainly ready to say hi to you. And this invitation comes from your good neighbors here at the LA Zoo.
Welcome back to Aging in LA. Our topic today, evidence-based programs for seniors. Programs that are based on prior evaluation. Our guests are Jennifer Wykowski from the Partners in Care Foundation and Muriel Guzzi, representing Kaiser Permanente. Thank you both for coming. Now, it's not Guzzi, it's Guzzi. I'm sorry.
Fuzzy, remember?
Okay, I knew, fuzzy. She told me. My fault. And I had no trouble with Wykowski. Isn't that amazing? Now, tell me about the programs, how people can access them. Now, Jennifer, I'm going to do this to you. There's a number where people can actually reach you, correct?
There is.
Okay.
Yes, people can feel free to call me to find out where these programs are being held in Los Angeles or other counties throughout the state. Call me, get that information.
And we're a test bed here, you said, because
Right.
That's pretty unique.
Right.
You know, California has always been in a leadership role, and with healthcare as well. Now, I have one here, managing ongoing health conditions. Is this, things get a little complicated as you get older because you're often dealing with 2 or more conditions. So how does that work to manage with the juggling act?
Well, in the workshops, there are various activities and techniques that we share with the participants. It's a very open atmosphere in the workshop. It's called a workshop because we want these people to do some work. We want to know what it is that they want. There's a lot of sharing of information. You know, your doctor may know what to do for you when you have a chronic condition, but I know best. I have a chronic condition. I know what I need to do and how to do it and when to do it.
I'm sure, like every workshop or support group setting, the first thing that you're shocked about is, oh, I'm not alone. There are other people dealing with this issue. Now, how do these workshops, how are folks gathered? Are they enrolled in the program or are they self-enroll? How does that work?
Sure. Well, we hold classes. Kaiser holds classes. Do you want to talk about that?
Well, at Kaiser, our doctors refer them now. We're very proud of that statistic. We've gotten to them. They are referring more and more to the program. People can come to it. They don't have to be referred. They can self-refer. They're available at every single one of our medical centers in both English and Spanish, and they are open to the community.
Wow, great. Well, to find out what happens in a workshop, we visited a class held at the Wilkinson Center in Northridge. Workshop leader Barbara Fox is moderating a discussion on managing ongoing health conditions.
Food has a different meaning for everyone. What, how, and why we eat are very personal things. We have developed these eating habits over years, so we are used to eating what we want, when we want it. Therefore, trying to change our eating habits is not easy, even when we know it is an important part of the self-management process. Okay, we're going to brainstorm. What are some of the benefits of healthy eating?
You'll be healthy and live longer.
Yeah,
I don't know about that.
Keeps your blood pressure down.
Keeps your blood pressure
cholesterol
down.
When you eat well, you have a better attitude overall.
Don't eat anything before going to bed.
Yes. No bedtime, no eating before bedtime?
You live to be 95.
Eating a morning breakfast is very, very important. because it helps fuel the body. After a long night of resting and fasting, that's why it's called break fast.
Oh.
Okay, breakfast means break fast.
Aha.
I'm not a breakfast eater. I never have been since I'm a little girl. Every once in a while I'll feel like having something for breakfast, but I just am not a big breakfast eater.
I always ate breakfast. And now, I don't care if I eat, which is very bad.
What prevents you from eating the way you think you should or want to?
The bad food in the house, that's the hardest thing for me.
Get rid of the
Like
bad
the chocolate
food in
chips,
the
the
house.
potato chips, the drinks. And
If you have it, you'll eat it.
That's right. I will. That doesn't mean everybody will.
They say eliminate fast foods. They're very, like hamburgers and stuff that you get at these pickup places, and they're extremely high in calories.
Try telling an Italian to stay away from pasta.
That, I'm not Italian, I love it too.
Right, exactly.
Using the fully whole wheat pastas, the whole grain pastas,
Yes.
and they taste the same.
Yes, yeah.
That's the trouble, and somebody said to me
Portion
the other
control.
day, they charge you $10 for a corned beef sandwich and they give you a pound of... I think that they should cut the portions and charge you accordingly.
One of the workshop participants, Norman Malesko, read a poem he had written about the importance of managing cholesterol.
A jelly roll can be delicious. Some folks intake cholesterol often in a manner quite capricious. Perhaps I am superstitious about my health and cholesterol. High cholesterol intake can be harmful. This is fact for me, not fictitious. How much cholesterol do I intake while being careful to moderate? At home and in a restaurant, my goal is to remain judicious. So, no more fatty donuts and high-fat ice cream for me. Norman Malesko. Thank you.
After the workshop, we asked Barbara Fox what kind of feedback she has heard from people who have participated in the workshop discussions.
See people after they've graduated the class or finished the class on the street, in the market, and they'll always come up and say, I've been doing the action plan every single week, which is a wonderful thing because it gets them in the mood and they become a person that will continue to work and to help themselves. And that's what happens. Whether it's their eating or whether it's reading a book or whether it's cleaning a closet, it doesn't make any difference. Just have a plan. And that's what we say. Just have a plan.
That's the sound advice, isn't it? Like, make a plan and stick to it. And so much of our lives, we just kind of by habit. The lady who spoke about, I never have breakfast.
Right.
The most important meal of your day.
Right.
And I have seen many times that seniors who can get out to senior centers where they serve food, all of a sudden their diet improves and their health improves and they become more engaged, and before you know it, they're fun to be around again.
And that's a simple change that someone can make in their life and have great benefit from.
But nothing is simple. Darn it, sometimes we've made it too easy to isolate ourselves. We have a lot of entertainment in our homes now, and the phone is there, but nothing takes the place of good nutrition and healthy exercise and being with your peers.